Human intimacy is one of the most important and fascinating parts of life. It's not only a biological function, it's also deeply connected to emotions, trust, communication, and mental health. Yet, many people misunderstand the balance between pleasure, safety, and emotional connection. Understanding intimacy from both a medical and psychological perspective helps people form stronger, healthier relationships and avoid harmful practices or beliefs that can cause physical or emotional damage. 1. The human body and sensitivity. The human body is designed with areas that are extremely sensitive and rich in nerve endings. These areas can produce powerful sensations when stimulated, but because they are delicate, they are also more vulnerable to injury or infection. Medical research shows that tissues in intimate parts of the body are thinner and more easily irritated than ordinary skin. When those tissues are damaged, even by tiny invisible tears, bacteria and viruses can enter the body and cause infections. That's why medical professionals emphasize the importance of protection and hygiene. Proper hygiene before and after physical intimacy, using safe methods, and avoiding rough or unsafe practices dramatically reduce the risk of infection. Intimacy should never be painful or forced. Pain is the body's way of signaling that something is wrong. 2 common myths about safe intimacy. A common misconception among young people is that certain physical acts are safe because they cannot lead to pregnancy. While it's true that pregnancy is not possible in some situations, disease transmission still is. Medical science clearly shows that sexually transmitted infections, STIs, such as HIV, hepatitis B and C, herpes, HPV, human papillomavirus, and syphilis can spread through any exchange of bodily fluids or contact with mucous membranes. Many people believe that if there is no traditional intercourse, there is no danger. This belief is not only false but also risky. Even a small wound or microscopic cut in the skin can become an entry point for infection. Moreover, some infections like HPV or herpes can spread through skin-to-skin contact alone without fluid exchange. Doctors stress that avoiding pregnancy is not the same as avoiding disease. To protect one's health, people need accurate information, regular medical checkups, and the willingness to talk openly about safety and consent with their partner. 3. The role of protection. Protection, such as condoms and other barrier methods, is one of the simplest and most effective ways to reduce the spread of infections. However, it is only effective when used correctly and consistently. Many infections are asymptomatic for weeks or months, which means a person might not even know they are infected. That's why health experts recommend routine STI testing, especially for those who have multiple partners or new relationships. Early detection helps prevent serious long-term complications like infertility, chronic pain, or cancer caused by certain viruses, like HPV. The use of barrier methods should not be viewed as a lack of trust or romance. In fact, it's a sign of mutual respect, both partners showing that they care about each other's health and well-being. 4. The emotional side of intimacy. Beyond the physical, intimacy has a strong emotional dimension. Emotional safety is just as important as physical safety. People who feel emotionally secure with their partner experience stronger and more positive physical sensations. This happens because of brain chemistry. When we feel loved and trusted, the brain releases oxytocin, the bonding hormone, and endorphins, the body's natural painkillers. These chemicals reduce stress, create relaxation, and deepen emotional connection. On the other hand, if a person feels pressured, fearful, or disconnected, the body releases cortisol, a stress hormone that can block arousal and cause discomfort. That's why consent and comfort are not optional. They are essential for genuine, healthy pleasure. Psychologists often describe intimacy as a language of emotions. Without emotional closeness, physical contact can feel empty or even harmful. Understanding one's own boundaries and respecting those of others is key to developing a meaningful and satisfying connection. 5. Understanding desire and choice. Desire is influenced by many factors: hormones, emotions, personal experiences, and social expectations. Every person experiences attraction differently, and no one should feel pressured to behave in a certain way just to please others. A healthy relationship is one where both people are comfortable expressing what they like and don't like, and where both feel free to say no. Medical and psychological studies show that people who communicate openly with their partners about what feels right tend to have higher satisfaction and lower stress in their relationships. Communication is the best way to prevent misunderstanding, disappointment, and potential harm. 6. Risky behavior and its consequences. Risky behaviors often arise from misinformation or peer pressure. Some people think that experimenting in unsafe ways will make their relationships more exciting or help them connect more deeply. Unfortunately, such actions can have serious consequences, not only medical but emotional as well. When the body is exposed to repeated irritation or infections, it can lead to chronic inflammation, scarring, or reduced sensitivity. Some infections, like HPV, can even lead to cancers of the cervix, anus, or throat. Others, like HIV, weaken the immune system for life. Emotionally, engaging in behavior that causes guilt, fear, or regret can also harm mental health. Many people experience anxiety or depression after unsafe encounters, especially if they feel they've lost control or were pressured. 7. The power of education and awareness. The best way to protect oneself from harm is education. Understanding how the body works, what risks exist, and how to prevent them empowers people to make informed decisions. Sadly, in many cultures, discussions about intimacy are taboo, which leaves young people with misinformation from unreliable sources. Comprehensive health education that teaches anatomy, consent, emotional intelligence, and safe practices has been shown to reduce infection rates and increase relationship satisfaction. Knowledge replaces fear and confusion with confidence and responsibility. 8. Psychological motivation behind risk. Psychologists note that risky behaviors in intimacy are often driven by deeper emotional needs, such as a desire for validation, novelty, or escape from loneliness. When these needs are not recognized or managed in healthy ways, people may take unnecessary risks. Developing self-awareness and emotional intelligence helps individuals understand what they truly seek, whether it's closeness, excitement, or reassurance. When those needs are met through communication and emotional connection, people are less likely to seek danger or extreme experiences. 9. The importance of mental health in intimacy. Mental health has a direct impact on physical intimacy. Stress, anxiety, or trauma can interfere with natural desire and responsiveness. People who have experienced past trauma may associate physical contact with fear or discomfort, making it important for partners to be patient and compassionate. Therapy and counseling can help individuals heal from past experiences and rebuild healthy relationships. In a safe, supportive environment, people learn to trust again and reconnect with their emotions and body in a positive way. 10. Respect, consent, and equality. At the core of healthy intimacy lies respect. Consent is not a one-time agreement but an ongoing process. It means that both partners are comfortable and willing, at every moment. If either person feels hesitant or uncomfortable, that's a signal to stop and talk. Mutual respect also includes equality, both people having the same right to express what they enjoy, what they dislike, and what boundaries they want to maintain. Power imbalances or emotional manipulation can turn intimacy into control, which damages trust and love. Healthy intimacy grows in an atmosphere of empathy, honesty, and equality. 11. Safe practices for long-term health. Medical experts recommend a few practical steps to maintain safety and health. Always use protection when engaging in any intimate contact. Maintain good personal hygiene and ensure both partners are clean and comfortable. Avoid physical contact when there are cuts, sores, or infections present. Get regular medical checkups and STI screenings. Avoid alcohol or drugs that impair judgment during intimacy. Communicate clearly about expectations, comfort levels, and boundaries. These practices are simple but life-saving. They show maturity and responsibility, qualities that make relationships stronger and more rewarding. 12. Redefining pleasure and connection. Real satisfaction doesn't come from risk. It comes from trust, emotional safety, and connection. Pleasure that's built on respect and understanding lasts longer and strengthens the bond between partners. When people treat each other with care, they create an environment where both physical and emotional needs are met. Modern psychology views intimacy as a mirror of personal growth. The more self-aware and emotionally mature a person becomes, the more capable they are of building fulfilling relationships. True pleasure is not just physical stimulation. It's the joy of being accepted, seen, and loved without fear or judgment. 13. When to seek help. Sometimes people face medical or emotional challenges that affect intimacy, such as pain, anxiety, or loss of interest. These are common and treatable. Talking to a doctor or therapist can help identify the cause and provide solutions. Avoiding the topic out of embarrassment only makes the problem worse. Seeking help is not a sign of weakness. It's a sign of self-care. Medical and psychological professionals are trained to help people understand their bodies and emotions without judgment. 14. Building a culture of healthy relationships. Creating a society that values healthy intimacy starts with open conversation. When people talk honestly about relationships, safety, and consent, shame disappears and understanding grows. Parents, teachers, and media can all play a role in promoting accurate information and positive attitudes toward intimacy. A healthy culture encourages people to make choices that respect themselves and others. It celebrates love not as something secret or dangerous, but as a natural part of human life that thrives on care, empathy, and responsibility. Conclusion. Human intimacy is a beautiful combination of biology and emotion. It can bring people closer, deepen love, and promote physical and mental health, but only when approached with knowledge, safety, and respect. Pleasure without protection and emotional understanding can lead to disease, pain, and regret. But when partners build trust, communicate openly, and respect each other's boundaries, intimacy becomes a source of strength, not risk. Medicine teaches us how to stay physically safe, and psychology teaches us how to stay emotionally connected. Together, they remind us that real fulfillment comes not from breaking limits but from understanding them, and from creating relationships where both people feel valued, healthy, and whole.